Peter Wing. Dr. Wing, thank you for being with us tonight. The floor is yours.
Thank you, Dr. Zeng, and thank you to Yiwei for inviting me. And it's really a privilege and honor to be able to share some of my research with you, and also to say how pleased I am. How many people are here? Here in the U.S., it's a Sunday evening for many of us, so not a typical time to participate in academic activities. And those of you in Asia, good morning. I think it's different time there. So let me try to share my slides before I start. Okay. Are these visible? Good.
Yes, yes.
So before I start, I just need to disclose that in addition to being a researcher, as Dr. Zeng has said, I'm also the owner and lead a Tai Chi school here in the Boston area, but my research and my private Tai Chi practices do not have any conflict and monitored by my hospital. So what I'd like to do today is just share a little bit about the Osher Center for Integrative Health here at the Harvard Medical School and Brigham and Women's Hospital, and talk about its long history, as Mila was saying, trying to build bridges between traditional Chinese medicine and Western medicine and research. Then talk a little bit about integrative medicine and how we define it here, and how it's important to balance reductionism, breaking things down into little pieces, with synthesis, seeing the whole person and whole person health kinds of concepts, which I think are very central to the practices of traditional Chinese medicine. Then I want to talk about Tai Chi as an example of whole person health and multi-component integrative exercise, and give you an overview of the research in Tai Chi, and in particular talk a little bit about Tai Chi for prevention. There's not so much research there, but it's something that we're trying to do. Big part of East Asian medicine is not fixing things after they're broken, but trying to do things early, prevention. I want to talk a little bit about Tai Chi in the context of healthy aging, and falls and cognitive decline and emotion are a big part of what happens for older adults, as well as chronic pain. I then Yue mentioned that he'd been doing some work with the X Prize and Dr. Peng's work, and in Southeast University, and he's worked here in Boston. We've worked together, and I want this to just share a little bit about our use of his framework of physiological complexity to look at these traditional practices, real bridging of Western quantitative tools and Eastern thinking, and then have some time for discussion. This is not meant to be a very formal presentation, so if anybody wants to just stop at any point and say, hey, wait a second, I have a question about that, or I have an observation to share, please feel free to interject at any time. I'd much rather it be interactive. Okay, so this is just a little overview of the history of the Osher Center. Some of you may know some of these very famous people. On the left here is Professor David Eisenberg. He helped found the center, the Osher Center for Integrative Medicine, at the Harvard Medical School. He was also the first medical student from Harvard to go visit in Beijing and be an ambassador to learn about traditional Chinese medicine, as well as to bring that information back to Boston. He started the center with Ted Kaptchuk. Ted Kaptchuk is also a scholar of Chinese medicine, and he wrote the Western famous book, The Web That Has No Weaver, in addition to doing some really pioneering work in Chinese medicine. He is also a world authority on placebo research, which grew out of his study of traditional Chinese medicine. When David stepped down from leading the Osher Center, the next director was Helene Langevin. Many of you may know her. Her work in basic acupuncture research really brought the whole world of connective tissue and fascia. And you can see from some of her earlier work, she was the person that showed that dirt qi, when needles have the grasp, it's not the muscle that's grabbing it, but you can see the collagen winding around that. That work has led to all sorts of beautiful basic research in animal models showing that when tissues, connective tissues, are manipulated, almost like when you pull the fabric on your skin, those mechanical pressures can turn genes on and off inside the nucleus, which then change local inflammatory processes. And so there's some very provocative ideas of how connective tissue might be involved in the therapeutic effects, not just of acupuncture, but of course in Tai Chi and Qigong when you're stretching or doing yoga or things like that. There's also mechanisms of connective tissue. And there's some really beautiful work that continues, and we continue to collaborate together. When Helen left about 8 years ago to become the director of the Institute of Integrative Medicine at National Institutes of Health, the NCCIH, I became the overall director at the Osher Center, in addition to running a laboratory here. And my partner in Tai Chi research for the past 25 years has been Gloria Ye. And so we've continued with this sort of bridging of East and West, as Mila said before. This is a picture of me probably in 2000, so more than 25 years ago in Beijing. And I'm meeting with Madame Feng Lida, who actually hosted David Eisenberg during his visit. And Madame Lida, Feng Lida, did some really beautiful seminal work with animal models in Qigong and some external Qi exercises. So it was a real honor to meet her as well. So it just gives you a sense that even though we're a conventional institute here at the Harvard Medical School, we've had a long history of trying to build a bridge between the East and the West. And I think that that has led to some very interesting insights. So today I'm going to talk a little bit more about the Tai Chi research, but I'm open to talking about our research on other aspects as well, including any acupuncture research you want to talk about. So I show this because I think most of you know that in the West, somewhere around the 17th century, late 1600s, but especially in the last 150 years or so, Western medicine has become really influenced by what we call reductionism. That means it's a way of seeing the world that believes that complex phenomena, including health, can be best understood by studying simpler components or basic building blocks or mechanistic processes. So smaller and smaller areas of focus. Reductionism has led to what we would call medical specialization in organ-based medicine, which of course for anybody in the West who's become seriously ill and in need of expertise of a cardiologist or an oncologist, neurologist, we're very lucky and grateful that people specialize in these areas. So there's departments, right? In more recent years, reductionism has drilled even deeper to understanding health and leads to insights at the subcellular, genetic, and molecular level, and great breakthroughs in precision medicine for cancer, cystic fibrosis, and many other conditions. But it's also my guess that most people listening today appreciates that there's costs or side effects to reductionism and specialization in medicine, namely the fragmentation of individuals and the way they're cared for into disconnected parts and processes with less of an appreciation of the whole person. My background is in evolutionary biology, and to use a phrase that we use in the West, sometimes reductionist medicine is not seeing the forest for the trees. We don't see the whole person. We don't see the connections because we're so focused on just the pieces. It's not uncommon here that if you say, I have a knee problem, someone will say, oh, we only do hips or ankles. We don't do knees. But of course, the ankles, the knees, the hips, the spine are all connected. Everything is interrelated. So taking things apart has costs. At the Osher Center, often in the West here, people define integrative medicine in a very high level way, like, oh, you have an acupuncturist in a pain clinic, or you have a Tai Chi program in a stress clinic, cardiology clinic. That's some kind of integration. It's like co-location. But for us, integration is much more. It's about seeing the whole person. And we know that when they say in Eastern practices and philosophy, yin and yang is the mother of 10,000 things. 1 + 1 doesn't always equal 2. That 1 + 1 can have some synergy and it can create more. And in Greek, the word for health comes from whole or holos. And so when the mind and the body, when the liver and the heart are balanced together, when the kidneys and the lungs are working together, when the system is working very well, that's where health emerges. And the goal, and this picture comes from a Western textbook on Chinese medicine called Between Heaven and Earth. The goal of the Eastern practitioner traditionally was to prevent people from getting sick, to keep the system in balance, to keep the ecology of health strong by making sure there's not too much fire and not enough water. Right? So that's our definition of integrative medicine. We draw principles from Eastern traditions, not just traditional Chinese medicine, but Ayurveda and other ones, which talk about integration and wholeness. Okay, so it's very different than just putting acupuncturists in a pain clinic or that kind of integration. And this view is growing a lot in popularity in the West. This is a very nice document if you want to learn more about this perspective from the National Center of Complementary and Integrative Health at NIH, National Institutes of Health. This is something that Dr. Langevin, who spent time here with us working together, then went there and put this together. And the main point is that analysis, you can think of analysis as breaking things down into smaller and smaller pieces. That's important. We know that that can lead to great breakthroughs, but it needs to be balanced with synthesis or putting things back together and understanding the whole. So they're not opposites like yin and yang, they're complementary processes. And if we're going to do synthesis, this part here, putting together, we have to understand how the mind and body work together, how the organs interact, the physiology of complex systems. So that's really important. And if we are going to take that approach, multimodal mind-body therapies like Tai Chi are really excellent tools because they impact the body in very complex ways and in a holistic way that brings integration. Okay? So that's sort of the higher level conceptual framework. And again, if anyone has any questions or wants things to be clear, try to be said a little bit more clearly, please feel free to just turn on your microphone and ask a question. So this is our working definition of Tai Chi. As all of you very well know, Tai Chi is rooted in a number of traditions from the East, including the martial arts, traditional medicine, and philosophy. And it integrates slow, intentional movement with breathing and a number of cognitive skills, including mental focus, heightened body awareness, imagery or visualization, like flow like water, or feel your spine hang from the heavens, or grow roots like a tree. We use a lot of information. It's not just moving. And then the goals of these practices are to strengthen, relax, and integrate the body and the mind, improve health, become aware of our own development. And of course, Tai Chi at a certain level for some people is also a very powerful self-defense technique in martial art. This is a cartoon that we developed to emphasize the complexity of these interventions. So in the West, we have interventions like an SSRI or an aspirin, which is a single molecule, right? A pharmacological agent that targets a receptor in the body and affects change from there. Tai Chi is very different, and many other mind-body practices. They're multimodal, meaning there are a lot of different active ingredients that are not necessarily pharmacological in this case. So when you're doing Tai Chi, playing Tai Chi, there's some aerobic component to it. You've got a lot of musculoskeletal strengthening going on, especially in the lower extremities. You're working on flexibility, etc. You're not interested in just pieces like your bicep or your tricep, but how do your legs, your trunk, and your arms connect? Structural integration, the timing and the coordination and the biomechanics are important, as well as the strength of the pieces. We've got relaxation of the body, the mind, as I mentioned before. We're asking people to be aware of how they're breathing, to feel the feet and how they do or don't connect to the arms. So a lot of attention in the body. You can think of this as mindfulness or meditation on wheels. While you're moving, you're paying attention to all these different things. And with that, all of these things you develop, you'll see a little later, executive function, because while you're moving, while you're remembering the sequence, while you're paying attention to the environment, while you're breathing, you have to keep shifting your attention between these things. So it really strengthens this part of your cognitive function. And I'll come back to that later. I mentioned before that we use a lot of imagery, even in the names of the moves. wave hands like clouds, or the white crane spreads its wings. There's an image. And we know from good research that even just saying, if I say soil or dirt, your chi goes down. If I say sky or the heavens, your chi goes up. Words change your physiology. Images, visualization change your physiology. We know from good placebo research, if you say this pill is going to help you and it's red, it has a different effect than if you say this pill is not going to help you and it's white. So what you believe um, really affects you. And we know from good phrases from the Tai Chi classics that your yi or your intention moves your chi and your chi moves your body, that these are actually well studied in Western medicine now, that the belief in imagery and placebo can have a big effect. And I think this was known thousands of years ago as people started teaching and developing these practices. Breathing's very important. Most of these classes that we teach in our studies, but also in my visits to Asia and China, there's huge social networks. You go to the park, if someone doesn't show up for Tai Chi training in the morning, they go bring soup if they're sick. There's a huge community. You're part of something. And we know that for older people, being isolated is one of the worst things in the world. It's like smoking a couple packs of cigarettes, right? And then, of course, there's philosophy embedded in the Tai Chi. Maybe don't give it 110% like in the West. More might not be better. Maybe backing off a little more yin, a little less, go with the flow, those sorts of things. Embedded in this exercise is a philosophy. So you see that this is very different than studying an SSRI or an aspirin, right? It's a complex intervention. This diagram here just explains how this might influence falling, and I'll say more about that in a few minutes. But there are many risk factors for falls in older adults. These ones here on the right are all well-documented risk factors that have been shown to be changed in rigorous randomized controlled trials of Tai Chi. For example, when you get older and you have sarcopenia or weakening leg muscles, you're at risk for falls. Tai Chi really builds lower extremity strength well. When you get older, or if you have diabetes, or if you've been through cancer therapy and you lose sensation in the soles of your feet, what we call plantar sensation or proprioception, when you lean back, you don't feel it because your nerves are less sensitive. And so the feedback is slower. So as you get older, that loss of proprioception increases your risk for falling. We've shown from good Tai Chi studies that Tai Chi can help regain or sustain the sensitivity, especially in the feet, but also in the fingers. Um, Reflexes, we can put people on treadmills while they're walking and make it stop so to, simulate slipping on a rug or falling over a curb when you're walking on the street. And what we've seen is people who practice Tai Chi uh, have not only faster reflexes, but smarter reflexes. The sequence that the muscles fire make it less likely that they're going to fall. I'll be saying a lot more about cognitive behavioral pieces, but the emotion of having a fall really changes how you walk. You can see the chi is stuck in the upper body. There's no sung or sinking of energy. And that fearfulness is a big predictor of falls. So pain, another predictor, I'll come back to it, is an independent predictor of falls, and executive function. So what I want to say here is that, again, just this is really maybe the big take-home message is that while there's some great value in reductionist research, looking at how one molecule hits a receptor and affects cells from there, Tai Chi is a multi non-pharmacological intervention that hits multiple systems, like in ecology, and changes everything in their relationship to each other to make the whole more efficient and to help health grow out of all those interactions. And this will also explain why we're interested in complexity theory, because complexity is based on all these system interactions and their quantitative tools to say how rich is the system? How are all the pieces talking to each other to create a whole? Okay. All right. I hope that is a good framework for understanding how we approach our research. So people will be quite surprised at how much research has been done in this area. This is some work I've done with a woman, Emily Guoyang Yang. She's now in Australia, but she was from Beijing. And she's done some beautiful synthesis of the literature. This is a couple studies put together, and I've updated the numbers based on seeing her a few weeks ago. But to date, there's more than 3,500 peer-reviewed scientific articles just on Tai Chi. Right? That's quite a bit. My colleagues here at Harvard are, wow, we had no idea this is so important. Um, this diagram also from this, and it's a little dated now, it's just up to 2019, shows that this blue line here are randomized control trials. And we know that randomized control trials are more rigorous. The quality of data on average is better than observational studies or epidemiological or cross-sectional studies. And you can see that these are the total numbers that continue to go up over time. And if we went, they would go all the way up to here if we kept going. But a larger and larger proportion of these are solid randomized control trials. Doesn't mean that just because it's a randomized trial, it's good research. There's really bad research that's randomized control trials. But we have ways of assessing the quality and making judgments on the evidence base based on better studies than worse studies. Okay. Emily as well, and some other people, myself included, have looked at systematic reviews, and there's a lot of systematic reviews. At this time, this is again dated, it's 2022, we looked at 210 systematic reviews. So this is a systematic review of systematic reviews to give you a high level. And what we concluded from this is that there's good quality data showing that Tai Chi can have multiple physiological, psychological, and quality of life benefits for a lot of conditions and different morbidities. This little table here shows you where I think the area has been well established. If you see an asterisk, like here for sleep, that means that there's multiple randomized trials that have been pooled together in a systematic review or meta-analysis that says there's good evidence for Tai Chi helping sleep. If you see two, that means that there's really robust data. And so I'll be talking a little bit about falls and fall prevention, and there's good data for that. My work with, especially with Dr. Ye, who I showed a picture before, we've done quite a bit of work in heart failure and hypertension and other areas. Hypertension research is very robust. I won't be talking about that. We've done a little bit of work in osteoporosis. Most of the work in osteoporosis is done in Asia. There's only a few studies in the West. One thing I'd like to emphasize is that so much of the work, important work, has been done in Asia, but it doesn't necessarily translate to the West. So if you think of osteoporosis, for example, the bone metabolism of Asian women is very different than Caucasian women, African American women, Hispanic women. So we just don't know if it translates. Not to mention the cultural differences of if your doctor says do Tai Chi in Asia, it's very different than if your Western doctor says, I've heard of something called Tai Chi, you should try it. It has different meaning. So sometimes there's evidence, but it needs to be replicated and compared between the East and the West. And I think there's some really interesting, exciting opportunities there. Quite a bit of work done in arthritis, especially arthritis of the knee. And I'll share one or two studies of that. We do quite a bit of work in respiratory issues, especially chronic obstructive pulmonary disease. We've done some work in Parkinson's and stroke. There's quite a bit of work going on in that space. I'll share some things on cognitive function and cancer is an area where there's quite a bit, and sleep as well. And we've got some really good people that work with C.K. Peng and others on sleep. Some of you may know Yan Ma from her work with others in Asia who works in our group now. So this is just a high level. These are the areas where things have been focused. I will say that there's some areas where there isn't much attention, and that's on younger people. And I think this is something that we want to be doing more. Not maybe necessarily just with Tai Chi, but Wushu, Kung Fu, other things to engage younger people earlier on in life so that they have some skills to manage their life course health. An important thing to just mention is safety. That's part of what we call the totality of evidence. And even though the data collected in trials is often not collected very rigorously, we did a review of 152 trials, and very few of them systematically report adverse effects in a way where you can say, we really believe the results. mostly at the end of the paper, they say no one really got hurt, but we don't know how carefully they looked and how many people they asked, and if they asked the people in the Tai Chi group as well as the control group. But by and large, um, there are very few examples published, even in very sick people. We've worked with people waiting for heart transplants, people in chronic pain, people who have histories of falls, and people do not typically have serious adverse events. So by and large, we think it's safe, but the literature on safety needs to be qualified. There's been a couple more recent studies summarizing the safety data since our paper. For the most part, things continue to show that it's relatively safe. So I'm going to just start now by saying a little bit about prevention. This is a quote from the Yellow Emperor's Classic on Internal Medicine. I'm sure you know it very well. And it says, to fight a disease after it has occurred is like trying to dig a well once one is thirsty or foraging for a weapon once a war has begun. So in my Tai Chi classes in Boston and in our trials, we often see people 60, 70, 80, some of our studies, people turn 100. And it's wonderful to offer these tools to older people. I really love teaching older people. I love making their lives a little better. But sometimes it's like an archaeological dig. There's so many layers of complex problems that we can make some difference, but we can't get to the full root of it. We can help with the quality of life, but we can't reverse some of the core conditions. So can we intervene earlier in life, especially with children, but even in young adults to make a difference? And the research on that is very limited. It's very, no one here at the National Institutes of Health is going to say, we're going to do a randomized trial and study people for 50 years. It's just not feasible, right? You don't have the resources, and it's just impossible to implement. So there are other ways of doing it. This is a study based on the Shanghai Men's Health Study. There's also a Shanghai Women's Health Study. Coincidentally or ironically, it's based out of Vanderbilt University in Nashville, Tennessee, in the United States, by Doctors Wong. It's a husband and wife team. And in the Men's Health Study, there are almost 60,000 people. So like most cohort studies, they recruit all these people and they make a lot of baseline measurements, BMI, blood work, epigenetics, all sorts of things. So they really can characterize the population and lifestyle things. And then they look at what are the sources of mortality. And in this case, one of my friends had the idea to say, well, let's look at their different types of exercises. Because it's Asia, I bet a lot of people do Tai Chi. And so, as he predicted, about a third of the people did Tai Chi. A third of the people walked every day. Some people jogged. Some people did Tai Chi with walking. Some people did walking without Tai Chi. And this is over a period of about 7 years. They looked at all-cause mortality. And in this case, I'm showing the risk of dying from cancer or the risk of dying from a cardiovascular event. And what you can see is that if you do Tai Chi, if the people who are practicing Tai Chi they started recruiting people around 40 years old, 40 to 74, there was about a 25% reduction in the risk of dying of cancer and about a 20% reduction in the risk of a cardiovascular disease. If you combined, uh, both Tai Chi and walking together, you almost half the risk of dying of a cardiovascular event. So this shows that doing Tai Chi earlier in life actually can prevent serious illness, cardiovascular disease, and death from the cardiovascular disease and cancer. But we just don't have a lot of information on this. People haven't done this. I would think that there are probably epidemiological studies in Beijing, in all the big cities. I think that this needs to be replicated. And it's a really low-hanging fruit to make some statements about the health benefits of these practices. This is a more recent study out of Hong Kong. Dr. Takamura is a nurse at, I think, Hong Kong Polytechnic. And it's a really lovely study, and she's done some really beautiful work. She was at our conference a few weeks ago, and she's does a lot of work on Tai Chi and mind-body practices in cancer. And this was a study looking at sleep, which is very important in late-stage cancer. This is in late-stage lung disease. It's a robust study with 266 people, and there were three interventions: Tai Chi or aerobic, traditional, conventional aerobic exercise, sorry, or a control, um, a weightless control. Um, and what they found, and they found that Tai Chi and aerobics were really good for sleep. Um, and Tai Chi was a little better actually. But what they did, which is really unusual, is even though the intervention was for 16 weeks, they followed people for a year. And what they found after the year was that those who did Tai Chi lived longer. They lived about 5 weeks longer than those in the control group. That's incredible. That's probably more powerful than most chemotherapy interventions. So not only is Tai Chi reducing symptoms related to sleep and fatigue and pain and all the other things we know that it does in cancer patients, but you live longer even with a very advanced terminal cancer disease. This is really cool, and I think more research has to happen on it. But these are some of the only studies I know about prevention. Everything else is working later in life. Okay. So before I move on, does anyone have any comments or questions they want to make? I'm happy if you don't, but I'm also happy to just take a break and
I have a question.
yeah,
So for the cancer patient, it's um especially for the advanced stage cancer, their body capacity to move is often limited. For so these patients, like our teacher of Tai Chi will ask them that just do their best. Is that also this study instruct them? Because if they cannot, or from some people's perspective, if you cannot move to certain angle or the movement is not good, it may not have the function to help them to improve the body movement. So is there anything that
yeah,
the
yeah.
study can show us?
Yeah, what you will see in the research I'll show is that there's a lot of variability in the interventions that have been done. Um, we have a joke that I made up here in the West. It's how many Tai Chi players does it take to change a light bulb? And the answer is 100. One to change the bulb and the other 99 to say, we do it differently in our style. There's a lot of variability, right? Particularly when you're working with very sick people, you never force anything. I mean, there are some very rigid teachers that say this is perfect and you have to move for perfection. But for me, Tai Chi is more like putting a comfortable silk garment over your body as opposed to trying to make you fit into some very perfect suit that wasn't designed for you. Tai Chi is adaptable. It's the principles. If you go back to the diagram, are you breathing? Do you have basically good posture? Are you using what you have as efficiently as you can? It's about using what you have well and not trying to be like anybody else or some master. That's what a good teacher does. Just like a good parent, encourages their students to use or their children to become all they can be based on, and one child might be different than another. You don't force them to be exactly the same. But that's how we teach in our studies. Um, and it's adaptable. In some of these cases, people may have to sit for pieces of the classes, where they may have to adapt things and have smaller stances. I think all of that is fine. So I don't think that that limits things. In fact, if we do that, I think people make more progress than if we push them too much.
Thank you.
Yeah. I see Teresa Eng has her hand up, I believe.
Sorry, I pressed the wrong button.
Okay. Anyway,
Sorry.
nice to hear your voice. Okay, so I'll continue then. So one of the areas that we spend a lot of time doing research because we work with older people is looking at Tai Chi for balance and cognitive decline. And as my guess is that this is not so different in Asia as well as in the West, but falls and cognitive decline are some of the biggest public health issues that we're struggling with. We know that adults over 65, 1 out of 3 of them fall at least once a year, and that there's tremendous public health consequences of this. Not only is there morbidity to the individuals and their family and a lot of suffering, but 1 out of 5 people who have a fracture after falling die within 1 year because of the sequelae. Not the trauma itself, but the change in lifestyle. They can't go out and socialize anymore. They can't groom themselves because they're impaired by their fracture and the sequelae. And it costs a lot. These are dated numbers, but the cost of society is really high. The impacts of cognitive decline and full-blown dementia are even greater. These are epidemic numbers. They're growing so quickly. And the problem is that we don't have a pill to take to prevent people from falling, and we don't have any good drugs yet for cognitive decline. We're trying. We hope we find some solutions, but there are limits to it. So we're looking to these non-pharmacological approaches, and I think there's a lot of promise in Tai Chi for both cognitive decline and falls. Traditional approaches, like I said, reductionism, breaking things down into specialties, has said, oh, if you have some physical problems, do some strength training, go see a physical therapist or, a physio, work on your flexibility, your agility, maybe a little bit aerobics. So for physical things, you do one thing, right? If you have mental problems, oh, you start doing puzzles, do some language, socialize, things like that. But what we know now is that even walking requires both physical and mental. And I'm going to say a lot more about this, that the mind-body is really essential, not just for the mind and the body for the body, but the mind affects the body and the body affects the mind. And this is what I think Tai Chi grew out of knowing. And so we've been doing research to articulate this. There's a big literature out there, not from integrative medicine, but just from good medicine and research showing that what you think affects how you feel and how you move, and how you move affects what you think. Yin and yang, mind and body, heaven and earth in some of the models of Tai Chi cosmology. So a lot of literature on this, and some of these people are colleagues that we've roped into our Tai Chi research, especially Dr. Hausdorff, who works also with Dr. Peng. So executive function, most of you know what this is. It's like the executive at a company. All right, you two work on this problem today. You guys work on this. In the meantime, one of you fix the conveyor belt, and they're the ones that just tell everyone to do, right? In the body, the executive function says, okay, now we're going to walk, but we're going to task shift. While I'm walking, I've got to look at the shelf to pick my food for dinner. While I have a conversation with my friend on the phone, it's about task shifting and paying attention, goal planning. You can't think about 2 things at once, but with good executive function, you can go back and forth and manage complex things, right? So that's really important. What this systematic review has shown, and it's from 27 big studies, is that people who have no dementia, no memory problems, but just a deficit, a small deficit in executive function, this part of cognition, have a 44% higher risk of falling than people who don't. Now, how does that work? If you just imagined standing on one leg, like a balance test, right? Okay, so I can do that. You're all young and healthy and strong and good balance. But if I ask you to do that and count backwards by 6.2, all of a sudden you got to go 6.2 from 500, and all your resources go to thinking, and those paying attention resources can no longer monitor your balance, and maybe you get nervous because you're going to get the wrong number. All of those mess your balance up. So this is how executive function and balance go together. And Tai Chi trains paying attention to a lot of things while you're maintaining movement and balance. So this is important. This shows you this new construct, relatively new in the last 10, 15 years, called motor cognitive risk syndrome. And it's a very simple measure that they do when you go into a gerontologist's office or someone involved in aging. And what they'll ask you to do is to walk 8 meters. and they have a stopwatch, and they can measure your time and ask if your walking speed is normal for your age or a little slower. All it is yes or no, right? And then they'll ask you yes or no, do you have any trouble with your memory, like remembering nouns or where you put your keys, and just yes or no. These are not complex neurophysiological exams. What this diagram shows, it's like a survivorship curve, and it shows a couple things. These are about 27,000 people, and this has been replicated many times now, more recently. So these are 27,000 people over a period of 12 years. At the beginning, where there's 100%, 100% of them have zero dementia. So these are older people over 70, but with no dementia whatsoever, right? What you can see is over these 12 years, a lot of them develop dementia. I'm sorry you can't see this axis, but this is like 40%, 60% here. And you can see that average is about, 70%. This is that epidemic I was telling you about, that more and more people are having dementia, right? What these different lines are, these are the people who have no complaints. So even if you have no complaints about balance or cognition, there's about a 25% risk of having dementia in 10 years, 10, 12 years. These are the people in the green line who had cognitive complaints. So if you have some early memory issues, you have maybe 10% more, 5 to 10% more risk. What I find really interesting is if you have no cognitive complaints, but you walk slow, it's a much better predictor of whether you're going to get dementia or not. So how you move, your gait, your biomechanics, this complex integrated thing is a much better predictor of long-term dementia than is just a memory problem. And then what you see here is that if you have both, you have even a higher risk. Okay. So that leads to the question. So if we know that movement and thinking increase your risk, should we have people starting to train multitasking? Should they be on a treadmill and doing Sudoku puzzles at the same time? Multitask training. And the answer is people are doing this now. This is an older gentleman at a assisted living facility, and he's doing physical exercises, strengthening exercises, balancing with the support of a therapist, but he's also doing cognitive tasks. Some of you, when you were younger, if you have children, remember doing Dance Dance Revolution and gamification. That's cognitive motor training. Put this here, move, but you're following patterns. And then there's even virtual reality, where you can walk through different landscapes and be challenged mentally while you're doing physical things. So this dual tasking is happening. But this is something they knew a long time ago in Asia, and Tai Chi is one of the oldest forms of dual task training. And so I'm going to say a little bit about what we've learned about Tai Chi on falls, the emotion of fear of falling, which is very important, the cognitive motor piece, the executive function, and how we studied that in the laboratory for the next few slides. So these are meta-analyses on the risk of falls. The Cochrane review, some of you know, is one of the more robust conservative measures. This is a little dated now, and it hasn't been updated for Cochrane, but it says that for very healthy people living in the community that are older, probably over 65, Tai Chi can reduce the risk of falls by about 20%. That's for healthy ambulatory people. If you look at people who are higher risk fallers, people who've had falls, people with neurological problems, Parkinson's, it looks like it's closer to 30% and maybe even 45 or more. Okay. So there's quite a bit of data out there that suggests that Tai Chi can reduce falls. Some newer studies have really emphasized how robust this is. This is some beautiful work by Fuzhong Li. Fuzhong Li is based in Oregon in the United States. This is a 3-arm randomized trial published in JAMA. Again, a little dated, but there's some new ones I'll show too. He had a simplified Tai Chi form, 224 people. He compared that to people doing resistance training, aerobics, strength training, things like that. And then the third group, which is more of the control group, was stretching exercises that were done in a chair. So people were all enrolled thinking they're going to get exercise for their health, but clearly the ones stretching in the chair are not going to change their balance as much as the other two groups. And so what did they find? They found that, and this was an intervention that lasted for 6 months, so it's a robust intervention, good sample size. After 6 months, the Tai Chi people versus the stretching people exhibited close to 60% reduction in falls. That's dramatic. It was even if you compared the Tai Chi to the multimodal exercise, you still see a 30% difference. So just doing the strength things you would do in the gym with a physio is not as effective. What was also dramatic was after 12 months, so after stopping the formal training and either working on their own or just the long-term effects of that 6 months, the people in the Tai Chi group had 75% fewer injurious falls over the following 6 months to a year. That's incredible. And this is important because this is where you really start to drive healthcare costs, people going to the ER and having surgeries and things like that because of injurious falls. Pretty incredible. Okay. So a little bit about the mind-body piece. Why would this happen? What are some of the mechanisms? So you can see this woman coming down the stairs is a little nervous, a little tentative. If anyone has an elder friend or a grandparent who's had a history of falls, they walk differently than people who haven't fallen. Many of them have a fear of falling. And you can see that the chi is a little stagnant in the upper body. There's no root. They're holding their breath. They're paying attention because they're very nervous about their environment. They're not embodied. And the problem with that is this is called fear of falling. When you develop fear of falling, you're less likely to want to go visit your friends, do your own shopping. So you start to become deconditioned and isolated. And then you get even less confident. So there's more fear. And that greater fear leads to an increased risk of falling. Fear of falling is one of the best predictors of falls. It's almost like a vicious irony. And it's very hard to break that cycle. Tai Chi is one of the best things that we've learned for this because you slow down and you can go, okay, you can even hold on to the back of the chair and you realize, oh, I'm squeezing my neck, I'm holding my breath, I'm not feeling my feet. And then you start to relax a little bit. And so there's a behavioral piece while you're doing the physical training. You're training the anxiety of falling with that. And so very good, robust research shows that randomized trials of Tai Chi reduces fear of falling, and that fear of falling in models predicts the risk of falling. More generally, we find in the West that a lot of people who have pain or have had falls or other things, are heart failure, are afraid to exercise because Tai Chi is gentle and can be adapted. Going back to the lung cancer question that Yue asked, because we make it accessible, people build confidence. And not only does Tai Chi training help them with Tai Chi training, but then it makes them more confident to walk more and do other exercises. We call it like a gateway exercise. It opens up the possibility to other things. So, any questions or comments before I shift to a little cognition? Okay. Oh, go ahead, Mila.
Dr.
Yeah,
Wing, I have a question. Maybe I have a funny questions.
I like funny questions.
I'm just curious, like, how come when like a baby born and grow up, when they're small, grow up, their like mobility, the balance are like not really balanced, but when people get older, they also like getting imbalance. How come?
Yeah, so it's interesting because little babies don't have very good balance when they first start. But they train and they hit a plateau of skill, especially if they're doing sports and gymnastics and wushu and things like that. Really helps. So it's important to lay those neurological pathways down early. But if you go back to the diagram I showed before, what are the risks of falls? As people get older, they lose muscle. Muscle weakness predicts falls. They lose sensation in their feet. That makes it easier to fall. They lose their vision, their hearing, and their vestibular systems. All these different processes as we age in a way that's not optimal make it more likely to fall. But I just was in Vancouver last week. I studied with a Sifu. I go visit there named Sam Tam. Sam Tam is now 86 years old. He looks like he's 50, and I've never experienced anyone's Gong Fu as strong as his. He can stand on one leg and put his little pinky here and say push, and he does this, and I go flying into the wall, like not a little, like I got hit by a truck. It's unbelievable. But he has not aged the way normal people age. And so I think that if we can give people these tools early in life, he's a remarkable individual. People won't be like him, but I think we can do a lot better than the average Western person. I also studied my background is in evolutionary biology of plants, and when I was studying at Harvard, Dr. Hu, um, I forget her first name, but she wrote the flora of Hong Kong. She wrote all the plants that were native to Hong Kong, and she collected all the plants in the library for plant collections at Harvard. And she was very close friends with my ecology mentor, my first mentor before I went to Harvard. And she was in the garden while I was doing my plant research, and she would show me these plants. She was so excited. And she was in her late 80s, and she described the flower of this plant that she was drawing. She's like, and when the bee lands here, it does this thing and it pushes all the petals. And here was this 86-year-old woman demonstrating this slow motion movement of the plants while she's talking and explaining, maintaining her balance. And I was just, she's a Tai Chi master, not only a famous botanist, but she has aged differently. So I think there are ways of hacking the system or preventing things that people assume is normal. But I think our Western lifestyle, sitting too much and thinking too much and making our chi, all the things you see as an acupuncturist are the things that we can also address through Tai Chi and change the course of aging.
Thank you so much. So you were saying the balance is trainable, right?
It's trainable. Yes, I think so. I think, and you can build strong reserves as a young person. It's very important to build bone as a young person, but also to build those neuromuscular patterns. Just think of if you are a gymnast and you're comfortable being upside down and doing all these different things, that's a very different nervous system to take into aging than someone who hasn't done anything. Yeah.
Thank you.
Yeah.
Also, we have one question here.
Yeah, please. I can't see the chat box, but I also see Sandy Fu wanted to say something maybe, or
Yes, hi, Dr. Ray. Since we're talking about balance, I'm just a little bit curious about your research on the intervention of using proprioception and the study, like what control group are you using, or like marker are you using?
Yeah, I'm going to show a little bit about, I think I have a study on proprioception, but I'll give you an example. This is done with Brad Manor, one of my students for a while. And we were looking in this case at people with diabetes, type 2 diabetes, who have peripheral neuropathy. So the soles of the feet, the nerves often have pain, but they also lose their sensation. So what we did in that study is we followed them for 24 weeks. In that study, they were their own controls. There was no control group. But what we did was we measured using filament tests. We can use a little like a pin, like an acupuncture needle, that's not so sharp, and ask people if they can feel this part of their foot, this part of the foot, like 9 points on the foot. And the numbers of places that they can feel give us a measure of proprioception. And what we found was over 24 weeks, the number of sites that people felt improved and the sensitivity of those sites improved, and that those changes were correlated with balance and gait performance as well. So that would be one way. You can use quantitative sensory testing to do other ways of measuring things. Some people measure sensitivity in the fingers and the hands with nerve conduction. Other people can actually measure the sensitivity of especially the fingers by looking in the brain at the sensory motor cortex, because those are represented well in those areas. And so some acupuncture research, for example, by Vitaly Napadov here at Harvard, has shown people with tunnel carpal, the fingers lose their sensitivity with this chronic pain, but after acupuncture treatment, the things start flowing, and each finger has more sensitivity. And in the brain, before treatment, if you touched one finger, the whole area for the hand lights up. But after treatment, when things start to become more sensitive, when you touch one finger, only one finger in the brain lights up, not all of it. That's called syndacty. So there are many different levels of this. What we don't know about the Tai Chi study is whether the improvement in sensation had to do with activities, uh, morphological changes in the nerves. Maybe they branched more and grew. Maybe the nerves that were there started having more sensitivity, or maybe there were no changes in the foot, but the parts of the brain that picked up the signal were more sensitive. We don't have those answers yet, but those would be different ways that we could look at that.
Thank you. Thank you so much. Actually, that's the part I was gonna ask, and you answered already. Like,
Oh, good.
we can't,
Good,
do
good.
that yet.
And there's a lot of work, as you know, Weidong Liu has been doing some work here at Harvard on chemotherapy-related peripheral neuropathy. And there's a couple other studies related to acupuncture. So acupuncture seems to be doing some similar things, particularly for chemotherapy-related peripheral neuropathy. And also, there's some other people doing some work around that too. So what's going on in the brain? We did a review of the papers. This again is dated, but there's some new studies here you could look at. And what we found is that there seems to be some evidence, not as robust as Tai Chi's effects on falls, but that it helps with both executive function and overall global cognitive function. And I'll give you some examples. This is an older study that was done in China. I like it because it compared Tai Chi to aerobic activity, to social interaction, and to another control. So there's 4 comparison groups. I also like it because there's a good dose. 40 weeks of Tai Chi is enough time to get a feel for whether it's going to make a difference. And they practice regularly for 3 times a week. And everyone was sort of cognitively intact. They had what's called a mini mental score of 25 or greater. And these are about average 68 years old. Okay. This is what they found after 40 weeks. Executive function here, which is the speed that you complete a test in. So the lower the number, the better. Was by far superior in Tai Chi. Tai Chi helped people do what's called the trail making test. In the trail making test, you're asking adults with a paper and pencil to draw a line from 1 to 2, 2 to 3, 3 to 4. Then you ask them to draw lines from A to B, B to C, C to D. But in the executive one, they have to go from 1 to A and then 2 to B. So in their minds, they have to switch categories. And these are examples of higher level executive functioning. So the timing it takes to do that was significantly different after doing Tai Chi. It's interesting. There are other executive function tests that show the same thing. There was an overall dementia index that was administered by neurologists, and you can see that Tai Chi did much better than the other groups. And then they also had the wherewithal of looking at overall brain volume, which is another reason I wanted to show this. And you can see that after 40 weeks, you would think that things are pretty stable in older adults, but there's room for the volume of the brain to improve. And it improved both in Tai Chi as well as in social interactions. Okay, so older study, but provocative. This is a newer study by Fuzhong Li, who's taken a simplified Tai Chi form and he's added what he calls cognitive skills. So while you're doing grass the sparrow's tail, you might be spelling grass, GRASP. While you're doing the physical movements, you're also training your mental things. You stand on one leg and you draw letters to spell, the Tai Chi movements with your other toes in the sand or on the floor. So there are different games that they came up with. And they compared that to the same Tai Chi that they studied balance with and the same seated stretching exercises. And what you can see is even the original Tai Chi form, this middle one, had significant improvements in what's called the Montreal Cognitive Assessment. These are clinically meaningful changes here. But what you can see is that the enhanced Tai Chi groups showed the best results. And compared to seating, there's quite a bit of change here. Okay, so Tai Chi can help with cognitive function, but again, the research on this compared to falls is still developing. And there's a growing amount of research showing that the clinical changes we see in cognition are correlated with things we can measure using sort of neurological tools. So fMRI scanners, FNIRS, brain-derived neurotropic factors, EEG, things like that, that the changes we see clinically are reflected in objective measures of the brain. There's probably much, much more research on the effects of acupuncture on the brain than Tai Chi. It's hard to study Tai Chi because you're moving and it's hard to, but with new tools now and tests that you can do in the scanner, people are starting to show that the brain is plastic and Tai Chi positively influences things that affect dementia. Okay, I'm going to go to pain now. I'm sorry, some cognitive motor stuff. Then I'll go to pain. So, but if you have some questions, just let me know. So how do we study this mind-body connection, this cognitive motor? Well, one way is by studying what we call dual tasking. Most falls happen when people are out walking or paying attention to a list, or, there's horrible examples, people in New York go on their cell phone and they fall on the train tracks, people who, are texting while driving and distracted. It's very hard to do these things at the same time. There's a cost for thinking while you're doing a motor task, and that's called a dual task cost. Okay, and so we can measure that. And this is an example of an older woman in our lab. On the top and the bottom, she started at the same time. She's about 70 years old. But you can see on the top, she's walking both faster, and you'll see when she turns around, she'll continue, than on the bottom. But also, if you look at the spacing between the steps, it's much more regular on the top. On the bottom, some are small steps, some are wide, some are to the left, some are to the right. There's much more variability in the step. Now, some of you have heard about heart rate variability. Heart rate variability is good when there's variation in the timing of the beat. Stride time variability is not good. Stride time variability predicts falls. And you can think if this bottom panel was really exaggerated, in Parkinson's, people get stuck. It's called festination. That's really bad variability. And they shuffle and then they go fast and slow. That's much more of a prediction of fall than this healthier gait. And so our question was, if this woman learned Tai Chi, even when she's counting backwards, will she walk more like the top than the bottom? Right? So this is our laboratory paradigm for studying mind-body connection. And the short answer, and we also know that the cost for dual task, the bigger the difference between the bottom and the top, is very predictive of falls, dementia, and many other problems. So it's a really good integrated measure of mind-body health. Not just the mind, not just the body, but the connection between the two. And so what we saw in one study was these are people not young, start at 85 years old on average. Some people turned 100. And after 12 weeks of training in Tai Chi versus receiving the same attention by nurses, learning about their health and aging, the speed of walking was much greater in the Tai Chi group while they were counting backwards than the bottom. So dual task cost, but also dual task performance was much better after doing Tai Chi. And more than 20 of these people were over 90 years old. So it's not too late to start learning Tai Chi. This is looking at the variability. And this is from a study. I'll show you the design of this later. But we, in the Boston area, sought out 30 Tai Chi masters, who averaged about 25 years of Tai Chi training between the age of 50 and 80. And we compared them to 60 people who were Tai Chi naive around the same age and gender matched. And this is the variability. Remember, variability is bad. And you can see that the Tai Chi experts, the timing between the steps while they're counting, the variability in the steps is much lower than the people who don't do Tai Chi. Then we can take these people here and randomly assign them to 6 months of Tai Chi versus no Tai Chi, and they start to become more like the Tai Chi masters over 6 months. Their stride time variability goes down, which means that they're much less likely to fall or develop dementia. We've also done this in Parkinson's disease. This is really important because in people with Parkinson's disease, as dopamine goes down, automatic movement becomes harder and they have freezing of gait. But they can compensate for that by paying attention to their body. But when we ask them to count while they're walking and they can't pay attention to the body, then we see real problems. And we see that after some Tai Chi training, that cost went down, the variability in their gait. Which is good compared to the people who didn't do Tai Chi. So I'm going to stop there before I do a little bit on pain, and then I'll be finishing up. But any questions on the cognitive motor piece, the balance, cognition, and Tai Chi? Okay, so pain's big, and pain gets in the way of movement and balance and things like that. But pain itself is such a huge issue, especially in older adults. You could look at the number of people in the U.S. with chronic pain. It's 30% people, and it goes, this is with aging, and that's chronic pain, and then high impact pain that really is disabling is also big numbers. A lot of money, a lot of terrible drugs. As acupuncturists, I'm sure you deal with a lot of chronic musculoskeletal pain and other pain. This is really prevalent. So what can Tai Chi do? This is a nice new study by Yang. He's based in New York, colleague, friend of ours. This was a study that was done remotely, so it was Tai Chi taught virtually. 350 people. The intervention included Tai Chi, some standing Neigong and Qigong practices, and then they compared that to a weightless control. These are all people that came in with stable chronic back pain. And the intervention was only 12 weeks. They met twice a week for 60 minutes. And you can see in disability, in pain intensity, in health-related quality of life, and in sleep, Tai Chi really helped so much more than not doing Tai Chi. So even 12 weeks virtually can change these very important chronic pain conditions that affect older adults. I want to say a little bit about the mind-body connection in pain in a couple of different examples. So the first one is some work done by Chen Wang, who's based here at the New England Medical Center in Boston. And she's a rheumatologist. This is a very well-known study in knee osteoarthritis. I mentioned before that Tai Chi, there's really good evidence in addition to this study from many other studies in the West and the East on knee osteoarthritis. What I want to emphasize here is this was what's called a non-inferiority trial. It's not saying is Tai Chi better. It's saying, is it as good as the gold standard? And the gold standard for knee osteoarthritis right now is physical therapy, which is quite successful. And what you can see here for pain scores, function scores, and overall assessment and health scores is that Tai Chi is as good, if not a little better, in reducing pain, improving function. Lower scores here are better than the gold standard. But only Tai Chi improved depression. And we know there's a lot of comorbidity of depression with chronic pain. Physical therapy did not affect depression. Only Tai Chi did. So this is part of that mind-body thing. And maybe with reduced depression, people are going to sustain these practices and they'll go deeper and they'll have longer-term better effects. So this is more of what makes Tai Chi different than just physical exercise. It's a mind-body, it's emotional, it's holistic, right? This is another study on back pain by a woman from Australia, Amanda Hall, and she found similar to Yang study that doing Tai Chi for 12 weeks reduces pain and bothersomeness of pain. But she was really creative, and she asked people at the beginning about their psychology. And one construct of psychology is catastrophizing, which means you worry a lot. So in my family. People joke, it's like, oh, you have a toe injury, and you think, oh, of course that's going to be toe cancer. And then in a couple years, you're not going to be able to walk, you're going to lose your job, and you're going to be homeless. And you keep worrying about this. And that worrying is so disabling that it starts to affect things. So that would be catastrophizing, and ruminating is you can't stop worrying about this. And people do this. It's very normal. Um, but what she found was that the benefits of Tai Chi on back pain, two-thirds of their effects could be explained by the psychology of Tai Chi, that it made them worry less and think less. It wasn't that their backs got stronger or they were more flexible or they had better balance, but the mental piece to this chronic pain was very important in changing the perception of pain. I hope that's clear enough. But again, another example of the mind-body connection. And the last example will come from some work we've done with persistent pain following breast cancer diagnoses. And this is a horrible situation. Um, just being diagnosed with cancer is like a trauma in and of itself. It's like, oh, you hear the C word. No one ever thinks it's going to happen to them, but it happens. Then after that trauma and that fear, you go through such invasive procedures. In this case, all of the women went through chemotherapy, radiation, and then they either had a uni or bilateral mastectomy or at least a lumpectomy. So they went through surgery. Then the sad news is that 30 to 40% of these women have persistent pain after treatment, after cancer is gone, after the surgery. And that pain keeps them in the memory of, oh, is this still the cancer? Is it coming back? Or, and there's so many different complexes. And in addition, many of these women who went through surgery have changed their self-image. Their breasts have been reconfigured, and their self-esteem and the way they carry themselves is different. So this is a very complex situation. Not one pill is going to do this. And we thought, here's a very complex situation, lots of different symptoms that are all interconnected. Let's see if we can use a mind-body intervention. In this case, we used Baduajin, the 8 brocades, and we had people in a circle with a very good teacher. They all had the same conditions, and they went through this breathing, talking about their problems, stretching, visualizing, doing all of the Qigong practices together. It's a small study, only 21 people, no control, but I share it because it shares a lot of interesting things. So this is changes in pain, changes in how pain influenced their lives, changes in anxiety, changes in depression, all of them changing from the same intervention. This is a really beautiful tool called, it's a mouthful, I apologize, the multidimensional assessment of interoceptive awareness. And there are questions in there. There are different constructs. One is called like the body, and there's a bunch of questions that you have to give a score to. But one question is like on a scale from 1 to 7, how would you rate this? When I'm upset, I take time to explore how my body feels. If I have an emotional thing, I look in my body. Trust is, I feel like my body is a safe place. And what you can see is, and there's a whole bunch of these I won't show, but between the beginning and the end, they trusted their body more. And whenever they had an emotional thing, they knew that this is not just in their head, that it's reflected in how they're breathing, how they're standing, and they can use their body to understand their mind-body connection. That's really important here. So this is a really lovely instrument. It's been validated. It's in Chinese as well as in English and many other languages. Beautiful work by Wolf Meiling, who's at UCSF. This is an example of one of the qualitative comments. We interview all the people before and after most of our studies because we want to hear in their words, not just the numbers we measure, but what was their experience. And this one woman who was very articulate wrote, "How you feel about your body is a challenge after you've had breast cancer. But mind and body have to be interconnected, all of it together in what we call Qigong mind-body exercise to them. It relaxes you, helps you stretch out a little bit, calms you down, helps you think about your body in a different way, and to trust your body, to get inside yourself in a different way, We're bringing them so they know it themselves. It doesn't mean you're not going to get cancer again, but it could mean that you're more at peace with your own body. And many of the women, when they started this, felt like their body had violated them. They didn't trust that their body was a safe place to live. That's horrible. You know, we want to feel like we live in a good home. And if your body doesn't feel like a safe place to live, that's not good for your mental and physical health. And what I think is really important are these concepts of psychological well-being, not just whether you fall or you don't fall or whether you can lift 20 pounds, but do you feel safe in your body? Do you feel comfortable? That's really important. And so we're seeing that in this study. We also looked, I'm very interested in biomechanics and posture. So this is, we can bring people into the laboratory, and each of these little dots are infrared sensors. And we know where they are exactly because there's cameras all around the room you can't see. So we can get very precise angles if we wanted to see how well they're doing Tai Chi or how their posture changed. And one of the things we were interested in this study is because of the chronic pain, because of the shame, because of being beaten up by Western medicine, we would see the shape where the head is forward and the back is rounded, like I give up, right? You can see people who are sad and depressed that way. And so we measured these angles here. And what we found was that the women who had the biggest changes from being like this to being upright, right? Um, Upright neck and open chest and not so rounded back are the women that had the biggest changes in depression and anxiety and fatigue. So small study, but there was a correlation between the shapes of your body and your mood, part of the mind-body connection, right? Um, some of you may have seen this famous book written to Westerners from this Japanese Chan Buddhist, Suzuki. And in the very first lines of his book, he talks about how to sit when you're doing Neigong practices or meditation. And he says these postures, these forms are not what you do to get to the right state of mind. Taking the posture itself means you have the right state of mind, right? And that might be too philosophical. So this is from our Western cartoons. This is Peanuts from Charlie Brown. And he says, he walks around like this all the time. And he says, this is my depressed stance. When you're depressed, it makes a lot of difference how you stand. The worst thing you can do is straighten up and hold your head high because then you start to feel better. If you're really going to get any joy out of being depressed, you got to walk around like this. And so I've written some papers about the shapes you make in Tai Chi and Qigong. They wire your cognitive and emotional systems. And you can see from humans, you can see it in apes. They like, I remember my professor in evolutionary biology saying it's very hard to be sad when you hold your arms like this, right? It's just it's not tight, but just like yay. These are codes, or your head's like this versus like this, or so the shapes we make affect how we feel. And I think one of the ways that Tai Chi changes emotions is not by just changing heart rate and inflammation, but the actual shapes you make change things. So that's some of the area of my research. The last thing I wanted to say is just a few things because I know Yue was saying he's working with Professor Pong on the X Prize, but we've looked at complexity. And when you put someone on a force plate like this, right, you can see that even a very healthy person moves around a lot. You're breathing, you're swallowing, the muscles change, which nerves are firing. So there's what's called a stabilogram or some movement. If you took this over time, you would see something like this, similar to heartbeat or any physiological signal. And the question is that there's a lot of richness in the signal. Why is this signal so rich? Well, partly because it's affected by breathing, by swallowing, by executive function, by muscles. So there's a lot of crosstalk, and crosstalk is good. Crosstalk creates complexity and richness. As people get older and the sense and the soles of their feet change, their vestibular system change, they breathe more shallowly, the heart starts to work less with the breathing, then the signal becomes more normal. And that actually means that you're unhealthy. So complexity, we think, is a good measure of health. And it links to this idea of Tai Chi being all these systems interacting. There's some really nice studies that CK and I and others have done working with people. This is the signal of older people who have fallen, and these are people who are younger people. You can see there's much more signal information and complexity. We can look at what's called sample entropy or multi-scale entropy, and what we see is that there's less information in the system. It's a simpler system if you're going to fall. So aging means you're losing complexity. And so the question is, can Tai Chi restore complexity? And we've been able to show this is a hybrid design that we use where we compare masters. And like I said before, after we compare the masters, then we take the people who are not masters and we put them in a randomized trial. And in the case of complexity of balance, Tai Chi seems to significantly improve the complexity of balance when you bring them into the laboratory for the experts versus the non-experts. And if we look at traditional measures, the complexity tells us something much better. It's a much more precise measure. And we've also done this in looking at heart rate signals, heart rate complexity. And we can see that Tai Chi experts have much richer heart rate complexity over these different multi-scale entropy scales. That's all I really want to say, is that this is a useful tool. So I want to finish up and just say that I think it's fair to say that Tai Chi is a promising intervention for many domains of health, including balance, cognitive function, and chronic pain that we talked about here. The multi-component mind-body training of Tai Chi, remember, lots of different components, physical, breathing, mental, may make it better than more simple Western exercises in addressing whole person health. And that all of these, balance, cognition, pain, all have a mind, a body, and multi-organ systems components. And that suggests that we need to think much more like the ecology of five elements and the systems of traditional Chinese medicine than just the heart people talking to themselves and the lung people and the kidney people. We need to look at how all of these systems interact in a systems way. Things like complexity, things like dual task measures, things like including affective measures, fear of falling, with falling, looking at multiple systems is much more like traditional Chinese medicine thinking, looking at the whole person and how the whole is more than the sum of the parts that leads to healing. So I don't have time to thank all the people. I'm a small part of all these studies, but I have amazing teams and resources here in Boston. So a lot of gratitude for my team. Thanks to the National Institutes of Health for funding my research. And I thank you all for showing up late tonight or early in the morning in Asia to listen. So.
Thank you so much, Dr. Rains. That was impressive with all the information we learned today, with the how that Tai Chi and Qigong can reduce many different disease. One of the things I learned is very interesting that you're in your MAIA, that one you mentioned, like when someone upset so you take a time to explore how your body feel. Because I know my father always get upset, and then he will speak words very hurtful. So this will be good wisdom. So maybe I can share to him that maybe take a time to explore how the body feels. So
yeah, I think it's a really important point. I just want to just echo what you're saying back again to everybody. I tell my students here, and in the West, we're a bit more psychological, I think. We think a lot, and a lot of psychologists and psychiatrists, and it's about, what about me? Whereas in Asia, it's more about family and culture, and then me is important, but here in the West, it's very me. And there's a lot of thinking, and many people have anxious thoughts or depressed thoughts, but it's very hard. Einstein said it's very difficult often to solve a problem using the framework that caused it. So it's very hard to think your way out of a thinking problem, right? So, when my son was young, he would get upset. And I wouldn't say stop thinking upset. I'd say take a deep breath because we know that breath, as we saw before, regulates heart rate. It regulates the flow of qi, the shen in Chinese medicine. Or I can say, can you feel your feet on the ground? Or can you feel how your bottom meets the chair? Are you squeezing your neck? And I'm not saying change your emotion, but it's like, oh, okay, I feel my feet. Oh, yeah, I'm not breathing. Oh, my neck is stuck like this, like I'm a deer in the headlight, like in the fight or flight response. If I change the physical body and the shape, the face, the hands, relaxing as opposed to, stay away. This shape is very different than this shape. Um, this shape is very different than this shape that that's what I think Maya is saying, that the body can keep the score. And what I think Tai Chi does is don't think about your problems, just move. And if you're moving smoothly and you're breathing, then the emotions will change with that because you can't have emotions without a body.
Yeah. And I will never forget this one. Yay!
Yeah. And there's a Western woman named Amy Cuddy who used to talk about when you're going in for a job interview and you're not confident to go to the bathroom first and stand like this for 5 minutes. And she's done some really good studies at the business school about body posture. But there's a paper I wrote called Can Tai Chi Shape Your Mood? And it's about all the research on this. And Charles Darwin did this work many years ago in the mid 1800s. He talked about facial expressions. You know, you don't need to ask someone if they're angry. You can look at their face. Before we had words, we communicated with our body, and Tai Chi knows that. It builds the shapes, the patterns, the relaxed face. You see a person walking without much light, and if they're walking smoothly, you go, oh, that's a young, healthy person. And then you may see their face and they're 80, 90 years old, but they're physiologically young. You see another person doing this, they're physiologically old, even though they're young. So,
Thank you so much for your wisdoms. Now let's see if there's any more questions. Feel free, just raise your hands, open your speakers, or you can just type
thank
it
you,
in.
Louis, for doing that.
All right, we have Ryan E. Yeah, feel free. Yeah.
Hi, this is Shani. I wanted to know, as your experience, which part of our body has the greatest influence of the Tai Chi practice? We're training our sinews, tendons, or ligaments, or training our brain function. Which part got the best influence?
Yes, all of it. But it might be different. If you have had a car accident and your legs are injured, that might be your most challenging area. So we need to focus on the ligaments, tendons, the strengths of your legs. If you have a history of trauma, it may be that, regulating your breathing and getting your heartbeat to change is important. Interestingly, you didn't say dantian. And the heart of health in Chinese medicine is the dantian. And all of Tai Chi is sync your mind, sync your Qi, be in your body, be in your abdomen. And we know now that what happens in your dantian or your stomach doesn't stay in your dantian from Western science. We've got the enteric nervous system, the original brain. There are more serotonin receptors in your abdomen than in your head. There's a whole other kind of deep brain in your stomach. We know that there's the microbiome. We know that there's the leaky gut syndrome and all sorts of things. Your center of gravity is in your belly. So if I had to pick one place, it would be the center. If we have a healthy dantian where deep breathing is happening, blood flow is happening, the digestion is good, the nervous system in the abdomen is good, sexual health is good, then all the meridians that pass through there are going to be good. So if I had to pick one place only, but I only picked that place because it connects to all the other places. So I don't think any one part can be isolated as the most important. They're all connected, but there may be weak links. And if we're doing a study with people with COPD, we may focus on different things than people with knee osteoarthritis or people with depression, but they're all connected.
Thank you, thank you. And I also have one more question. Do you think which kind of the diet will be more benefit for Tai Chi practitioner, like a keto diet or some of the more protein diet or vegetarian diet, even though?
Yeah, that's such a big question. Independent of Tai Chi, I think that we just don't know. And I also believe that there's certain constitutions that might do better with one diet versus another. Um, and but I think that um, eating in moderation, not eating too much, certain times of the day to eat that are better than others. I think some very basic things. But beyond that, I'm not an expert on nutrition, but I also know because I work closely with a lot of nutritionists that there is no one perfect thing that everyone should do. Um, but I think that a lot of people have done pretty well with Mediterranean diet, but that doesn't mean you shouldn't eat protein or you shouldn't eat animals or things like that. I think, but everything in moderation, I think, makes sense to me. Um, but It's a good question. And whether there's an interaction and with how well Tai Chi works, I don't know. Certainly for like osteoporosis, if you were trying to study how Tai Chi can load bones, then certain types of supplements or diets or things like that that change inflammation and other things might be really relevant. But I think the microbiome is increasingly important. There's some new studies, small ones, very small ones, that show doing Tai Chi changes the composition of your microbiome, which then is going to change nutrition and other things like that. It's a good question.
All right, I see the next question. Sandy Fu, feel free to speak your questions.
Hi, Professor Winnie. Thank you so much for hosting this presentation. I like how you were mentioning about the brain-gut connection because it's such a trendy topic nowadays, and there's a lot of research shows the evidence of, the effectiveness. Effectiveness through we so-called mind and body connection or influence. Because I know that in biomedicine they don't call mind body connection, but they are focusing on or like, researching on brain gut, connection. We just so call it, mind body because it's a different terminology. But however, there's like an integrative area that I'm very interested about it. So my question is, what do you think about the application of Tai Chi in practice in terms of like, is there certain protocol for different types of condition or like what is your you know what I mean? Like because I have
Go ahead.
sorry, because I have learned Tai Chi for like twice or like I have practiced a while in school, but then I never got interested in, going deeper of thinking of the mechanism until today that I saw a lot of research you have done that shows different data in different areas. So I'm very curious about like the application of like if there's a protocol or something, like how do you guys do that in practice?
Yeah. It's a very logical question. I don't know how you practice your acupuncture or your herbal practice or your tuina or all the other things you probably do to integrate your practice. But your goal is partly to manage symptoms, but underneath that, to build the root, to build the chi, the flow of chi and blood, the balance. And that's what a good Tai Chi program does. It doesn't just try to fix balance or emotion. It tries to make the person feel safe in their body and build strength slowly that's appropriate for them. Um, how that happens, I don't think that the 24 form or the 108 form or the Chen style or the Wu style or the Sun style or the Yang style are particularly better or worse. I think if you have a good teacher and they focus on the core principles, that's what's going to change things. It doesn't matter if, you do this many movements and you move this hand. You can move your hand this way and this way and this way, and it means nothing. But if I say move as if you're, you know, um, trying to move water, and when you do this, you don't just use your arm, but you feel your legs. And when you do that, you relax your neck and you feel your breathing. Then you start to get into the core Tai Chi principles. And it's more about how well you do pieces with the mindfulness and the core principles than if you do 106 moves, for 30 minutes a day. So I think the forms are helpful. They give you something to practice, but that's just the beginning. Um, and the question is, how deep can you go and to learn the qualities? And the way we teach here, which is very unusual, we don't teach a lot of forms. We teach principles. So they may do the push for 5 minutes back and forth, just pushing and relaxing. And because they don't have to remember what's next, they can remember, oh, I have to breathe when I'm doing this. Oh, I can't tighten my neck. Oh, I have to feel both my feet. Oh, I have to notice these things. So you can start to go deeper into the quality of the movement, and not so much the quantity. And then when people have those principles, then we teach them longer movements and sequences because they can do them better. But at first, they're confused and they're trying to remember the movements, and most of them quit very quickly. They don't have the patience in the West. So, how do we make it feel good from the beginning and build the choreography out from there? So, it's a slightly different approach. So, it's a logical question, but I don't think there's any one movement that's particularly good for any one symptom. Um, yeah.
Right. So now that you need me to think about um how do you measure that? Like if a coach, let's say, or the group of people who's guiding the patients doing this, like
Mhm.
apparently there's an influential factor on the people who's communicating or setting
Mhm.
up the experiment. Like how do you avoiding the blinds, or like how do you measuring?
Yeah. So a good teacher, like if now there's Tai Chi tournaments, even Qigong and yoga tournaments. It's crazy. There's even meditation tournaments, which makes me crazy. But you can go and do your forms, do your wushu, and the judges will look at your movements, the smoothness, your balance, your yi, your intention, and they can assess the quality, and give you a score. And if you're very good, you win the tournament as a good practitioner. We've been doing those sorts of things in our studies as well. We're interested in how well do people perform based on key principles, um, posture, relaxation, and act. Is there yin and yang in their movement? Can we see how they're breathing? We can also put sensors on their body and measure depth of breathing and heart rate variability and um, look at blood flow in the brain, those sorts of things. So there's ways of quantifying the quality of performance. And we're just starting to do this now. And our hypothesis is that people who do 10 hours, 20 hours versus 10 hours of practice in a month are not necessarily going to get better, but the people who do good quality practice for a period of time are going to have better clinical outcomes than the people who do bad quality practice. And so we're really interested. It's a very important question how you measure that, but we're starting to be able to do that.
Thank you so much.
All right, we have a question in the chat box here. Do you think Tai Chi is a type of Qigong? Have you done any research on other type of Qigong as compared to Tai Chi?
Yeah, well, we've done, so the study I showed you was on Badua Jin. There are many different types of Qigong that have been studied, as well as many different types of Tai Chi. There's also Neigong, just mindfulness and breathing exercises without much movement or standing practices. There's some research there. Very few studies have compared two different approaches in the same study. You've seen some of my studies comparing Western exercise to Tai Chi, but no one has said, very few people have said we're going to compare Wu style versus Yang style or Badua Jin versus Yang 24 for this. Those are tricky. Often the people who are designing those studies are trying to prove that their system is better. So there are not very good studies yet that have compared systems. I think it's an interesting question. My feeling is that the system itself is probably different, but how people teach it, what words they use, the way they interact, those things probably have a huge impact, not just whether you do a lot of movements this way or faster or slower. It's more the way it's taught, and that has not been studied yet. But these are all logical questions because you see in the literature, Tai Chi's good. So now what do you do? Which one do you do? How do you teach it? We don't know yet. I think that's the next phase of research. Similar to someone saying, does acupuncture work for lower back pain? Most of you say yes. And then the question is, what approach? What points? What kind of stimulation? How frequently? All those things. Those are just, and is it just the needling or is it the music in the room and a very nice person saying you're going to be okay and telling you about lifestyle? And so acupuncture is a complex system. It's not just the needling. Tai Chi is a complex system. It's not just the movement or the forms.
Alrighty. Because the time we are opening for one more questions. Sandy, you have the
Thank you.
question.
Thank you for giving me the opportunity.
Yes.
Professor Winnet, I'm wondering, like, I'm curious about your opinion on the application of putting, or including Tai Chi in the, general insurance or like practice in the future. Like, what do you see the future of practice of Tai Chi in United States? Like, we know, for example, physical therapy is such a big markets in America and a big part of programming in healthcare system. Like, what do you see the place of Tai Chi in our current health system in the United States?
Yeah. No, it's a great question. I think there's a place for adults that want to do stress reduction and meditation, but don't have the patience to sit and meditate. They just can't do it. So Tai Chi becomes a tool where you can move a little bit, you can be in a group, and you're starting to get those therapeutic qualities. So I think there's a place where the doctor would say, oh, yeah, you need to start doing some things. Here's a prescription. Go to this Tai Chi school in Boston or that school, or a hospital has some programs, things like that. Or even there's some online resources that you can begin to learn. That could be for stress management. It could be for balance issues. It could be for neuropathy or pain. I think that there are programs like that will be integrated. And as more evidence emerges, doctors are going to be advised to include this in their prescription, and hopefully health insurance will cover it. There's been some movement towards that in acupuncture. It's taken a long time, but now acupuncture is covered by a number of different health insurances. I think early in life, as I said, it would be really nice if this was taught in schools. My understanding is that in high schools and in colleges, it's almost mandatory to do a little bit of Tai Chi. So we can reach people earlier in life. I'm not so sure in schools whether Tai Chi is the right mix. I would do animal frolics and things that children like to play. Moving like a tiger and being strong like a bear. There are ways of moving that change your emotion, and making sounds and things like that that I think are going to be more attractive to younger people, or Gong Fu, or Wushu, or things like that. I think, or dance, traditional Chinese dance would be really good. And if we can integrate it early in life for part of prevention and wellness in schools, that'd be great. We're trying to develop this for our healthcare providers. Can we teach our nurses and our doctors and our staff, because there's so much burnout in Western healthcare providers? Can we teach them so that their lives are better, but then they become better providers because they're more clear, they have better energy. And when they have a patient that has a problem, they may be able to say, I've been doing this thing called Tai Chi. You should be interested in this. They become our ambassadors. So that's another way we're trying to integrate it. I think in assisted living facilities at the other end of life, nursing homes, those sorts of places, obviously there's a really good place for this, these tools for cognitive function, along with everything else. I don't think that it has to be done alone. I think, for example, we're doing studies now with people with COPD, respiratory issues, or they have a heart attack. They go through a 12-week rehab program, cardiac rehab or pulmonary rehab, and they're told to breathe and to walk. And while they're doing the program, it's great. After 12 weeks, they all stop. So what we're trying to do is, while they're learning that, can we teach them principles of Tai Chi, how to walk and breathe while you're walking. Walk not because you're trying to get steps, but walk because you deserve time for yourself. And are you walking with only pieces of your body, or is your whole body walking? Can you feel your feet connect to your legs and belly? Can you feel your head move when you breathe and you walk? So we change how they perceive exercise. And then even when they do regular activities, laundry or cleaning the house or washing the dishes, they can be practicing these principles. So there's a way of integrating these ideas in a very simple way. And we're studying that in some of our studies as well. So it's a great question. I think as we learn more about how this works and who it works for, then we can think about how to implement it, how to integrate it, and how to get our healthcare system to support it. But that's why we do the research.
Thank you so much for such a wisdom teaching lessons today. If there are other more people have more questions, how do they reach out to you?
You can send me an email.
All right.
I can put my email in the chat.
I appreciate
It's
it.
easy to find at Harvard. There's not too many Peter Wings that do research in Tai Chi.
Yes.
But if you have a question or you want me to point you to some literature, I've just put my email in the chat, and I'm happy to do my best to try to answer.
Awesome. I will share this one to our group as well. And also, I'm very interested into reading your book as well. So, yeah, looking forward to.
Good.
And I want to thank you so much, Dr. Wayne, for such amazing inspiration talk. And we are deeply appreciate your time, your wisdoms, and dedication to the advance of whole person health. And thank you everyone who joined us tonight. We wish you all good health, happiness, and continued learning. So with all that, have a beautiful evenings, and we hope to see you all again soon. Thank you, Dr. Wayne,
Well,
again.
thank you for hosting me, and thank you for listening. And I still feel like I'm learning, so I hope I didn't say anything that's too wrong from the wisdom that you all have as well. So, but let's all keep communicating and learning from each other. So thank you.
Thank you.
Thank you, Dr. Wen.
Thank you. Have a
Good
great
night.
day.
Thank
night.
you,
Oh,
Dr.
good
Wen.
morning too. All right. Bye, everybody.
Bye.
Bye. Bye, everyone.